Today, I'll be sharing with you a deeply personal testimony of divine preservation, medical wisdom, and preventive health care. A testimony of mercy, a testimony that reminds us that even in moments of fear, uncertainty, and pain, God remains faithful. Between Sunday the 10th and Wednesday the 13th of May this month, I experienced a sudden and frightening health episode. The pain in the chest came violently and repeatedly. It became worse whenever I lay flat, worse when I tried to breathe deeply, worse when I moved my chest or trunk. Monday night, I woke up at 1 a.m. and couldn't move my chest an inch. And honestly, at that moment, I wondered if I was facing something life-threatening. Thoughts of pulmonary embolism, lung collapse, cardiac complications, and other hidden emergencies crossed my mind as I carefully monitored my symptoms and underwent medical investigations through the next couple of days. But through it all, God preserved me. As the investigations progressed, the mercy of God became more evident. My oxygen saturation remained normal. My blood pressure, which had always been good through the years, stayed stable. My pulse remained stable throughout the ordeal. The chest X-ray showed no lung collapse, no major pneumonia, no destructive lesions in the lungs. The abdominal ultrasound scan was also essentially normal. No gallstones, no kidney stones, no obstruction, no tumor, no obvious internal abnormality to explain the terrifying pain. Even my blood sugar readings remained normal, even though I'm a non-diabetic. However, the chest radiograph suggested mild enlargement of the heart with possible hypertensive changes requiring further evaluation through ECG and echocardiography. And this is where things became both medically enlightening and spiritually humbling. The echocardiogram results were actually very reassuring overall. The heart was pumping well. There was no major structural failure. One finding was called mild concentric left ventricular remodeling. Now, in simple terms, this means the main pumping chamber of the heart shows mild thickening or remodeling over time. This can happen due to long-term blood pressure. I've never had high blood pressure. Aging, at 54, I did wonder. Increased body weight, now take that, obesity, sleep apnea, or long-standing metabolic stress. Importantly, this was mild remodeling, not severe heart disease. Another very reassuring finding was this: my heart pumping strength, what doctors call the ejection fraction, was 66%. Normal is generally between 55 and 70%. That means the heart's pumping ability remains strong and preserved. There was no major systolic heart failure. The report also showed grade 1 diastolic dysfunction. Now, this sounds alarming. It did sound alarming when I saw it, but it is actually very common, especially after age 50. It simply means the heart relaxes slightly less efficiently between beats. It is commonly associated with mild hypertension history, increased body weight, thick again, aging, and early cardiac remodeling. And in many people, it causes no symptoms at all. There was also mild mitral regurgitation, a tiny backward leakage through one of the heart valves. Again, mild cases like this are extremely common and often clinically insignificant. But one particular finding was especially interesting. The echocardiogram showed a tiny pericardial effusion. In simple terms, a very small amount of fluid around the heart. And this may actually explain the type of chest pain I experienced, because the pain was positional, right-sided, worse when lying flat, painful with deep breathing, and improved sitting upright. This pattern fits something called pleuropericardial inflammation, a mild inflammatory irritation involving the lining around the heart or lungs. Thankfully, this resolved quickly. Most importantly, the investigation showed no evidence of heart attack damage, intracardiac clot, dangerous valve disease, pulmonary embolism, or severe structural heart disease. What the enemy may have intended for destruction, God turned into a testimony of preservation. I saw the hand of God sustaining my breathing, stabilizing my heart, preserving my organs, guiding my decisions, and granting me peace through the process. This was not luck. This was mercy, God's mercy. And this experience also carries important lessons for all of us, you and I. Sometimes the greatest danger is not what happens suddenly, but what quietly develops over years. My results did not suggest advanced heart disease. Instead, they reveal something many people unknowingly have: early cardiovascular remodeling. And this is where preventive healthcare becomes critically important. Monitoring blood pressure, blood sugar, cholesterol levels, body weight, sleep quality, and overall metabolic health can dramatically reduce future cardiovascular risks. At my height of 1.72 meters and weight 104 kilograms, one of the most important medical recommendations was weight reduction. Even losing 10 to 15 kilograms can significantly improve cardiac workload, blood pressure, inflammation, heart relaxation, and long-term heart failure risks. This was a major wake-up call for me. And perhaps someone watching this video today also needs that wake-up call. Evidence-based lifestyle interventions matter tremendously. Simple things like regular brisk walking, cycling, swimming, reducing excess salt intake, improving sleep quality, and maintaining healthy blood pressure can profoundly improve heart health. The recommendation is about 150 minutes of moderate exercise weekly, starting gradually and safely, of course. Sleep health is also important. Conditions like obstructive sleep apnea are often overlooked and can contribute to hypertension, heart remodeling, fatigue, and cardiovascular strain. Nutritionally, some supplements may support cardiovascular health when appropriately used, including omega-3 fatty acids for anti-inflammatory and heart protective effects. It also helps with cholesterol, triglycerides reduction. Magnesium for cardiac relaxation and blood pressure support. Coenzyme Q10 for myocardial energy support. And where vitamin D is deficient, supplementation helps. But importantly, lifestyle changes matter more than supplements alone. One important medical recommendation, in my case, was also to avoid extremely strenuous exertion temporarily though, while the inflammation completely settled. And this highlights another important lesson. Not every chest pain means catastrophe, but every chest pain deserves proper evaluation. Early medical attention matters. Preventive healthcare matters. Awareness saves lives. Today, I am grateful to the Almighty God, grateful for preservation, grateful for medical wisdom, grateful for timely investigations, grateful for peace in the midst of uncertainty, and above all, grateful to God who did not allow the enemy to prevail. At Famedix Pharmacy Health Aid Diabetes Care Center, we remain committed to preventive healthcare, diabetes care, cardiovascular wellness, patient education, and helping people detect problems early before complications arise. Because sometimes awareness truly saves lives. Thank you so much for watching this to the end. Please remember to like this video, subscribe to our channel, and share this message with someone who may need both encouragement and health awareness today. Again, this is pharmacist Adim Udeh from Famedix Pharmacy Health Aid Diabetes Care Center. Stay healthy, stay informed, and may God preserve you always. Thank you.